Assalamu alaikum and good morning to one and all. Today we'll start with a new chapter, that is drug use in a special population. I am Professor Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to discuss why there is increase in incidence of adverse drug reaction and drug interaction in elderly patients, and discuss pharmacokinetic and pharmacodynamic changes in elderly patient. So let's start with the first topic, learning outcome. So before that, we'll see what do you mean by special population. So there are few category of the people who are called as special population, because in those cases or in those people there is change in their normal physiology. Since the normal physiology of those patients is changed, accordingly the effect of drug it is also changed in case of those patients. So the people belong to these categories are, first one, it is the geriatric patient. So the geriatric are those patients who are also called as elderly patient. Okay, so the elderly means they are having more age. So when age is progress, their body physiology is also changed. Since there is change in body physiology, the effect of drug it is change in those patients. So when you are giving medicine to the geriatric patient, you should consider all those parameters which are changed in case of geriatric patient. Second special population are the pediatrics. So the pediatrics are those who are having the less age. So especially the children's, they are called as the pediatric patient. Okay, so the children's or newborn baby, they comes under the pediatric patient. Since their physiology is completely different, their all organs are not yet developed, so system it is not completely developed, so the drug they produced different types of action in those patients, and you need to change either the dose or the drug when you are giving medicine to the pediatric patient. So this is the second population. And third special population, it is a pregnant woman. So in pregnant women there is tremendous change in the hormones. So the hormonal change it is occur in case of the pregnant woman, and due to change in the hormone, the drug they may produce the different pharmacological action, or they may interact in different way in case of pregnant women. So when you are giving medicine to such kind of special population, you need to consider what are physiological changes occur in a geriatric patient, what are physiological changes occur in the pediatric and the pregnant woman while giving the medicine. So you must be very cautious while dispensing medicine to this category of the patient as a pharmacist, and a physician must be cautious while prescribing medicines specially to the special population. So this is the reason why when you are giving medicine to the pediatric patient, it is better to go to the pediatrician instead of going to the general physician or GP. It is better to consult the pediatrician. Likewise, in case of the pregnant woman, it is better to consult the gynecologist who take care of the pregnant woman. The gynecologists, they are expert in the physiology of the pregnant woman. So accordingly, they can understand and they can prescribe medicine to the woman which is best suited for that particular pregnant woman. Okay, so these are different special population. So we'll see one by one. So today, in today's lecture, we'll start with the first population, that is geriatric population or the elderly people. It is observed that there are ADR and DI, or that is the drug interaction and adverse drug reaction. They are more common with increase in age. So as age is increased, there is the risk of adverse drug reaction and the drug interaction. It is also increased in case of elderly patient. Let's see what is the prevalence of ADR and the DI in case of elderly patient. So these figures are in comparison with the figure of the adult patient. So it is observed that the prevalence of about 11.8% of the patient at the age of 41 to 50, they experience adverse drug reaction. Whereas same adverse drug reactions, if they are below age of the 40, then it is observed that there is less prevalence of adverse drug reaction. It means when the age it's come between 41 to 50, the prevalence or risk of ADR it is increased by 11.8%. Okay. Likewise, as age is increased, and you can see here, it increased to 25% in the patient over 80 years of the age. So if age is increased, the risk of adverse drug reaction it also increased by the 25%. So overall, when there is increase in age or the patient become more elderly, it increases the risk of both adverse drug reaction and the drug interaction. Now let's see why in geriatric patient or the pediatric, or we call it as the elderly patient, there are increase in incidence of both drug interaction as well as adverse drug reaction. So we'll see the step-by-step reason for increase in prevalence of ADR and DI in elderly patient. So the first reason is the elderly patient need more number of drugs at a time. Why they need more number of drugs? Because elderly patient they are suffering from many diseases. They suffer from hypertension, they suffer from diabetes, they suffer from mental illness. Since there are more diseases, they are on treatment with more number of drugs. Since they are taking more drugs, so as a result of that, it increases the possibility of drug-drug interaction, and the ADR are generally related to the DI. So this is one of the possibility, because there is increase in number of the drug consumption by the elderly patient. Likewise, it is also observed that the drug elimination become less efficient in elderly patient. So we'll see that in a detail when we see the pharmacokinetic parameters which are changed in elderly patient. But at this instant, you just remember that there is decrease in elimination of the drug in elderly patient. Now, when the drug elimination become less efficient, as a result of that, it lead to drug accumulation into the body. So drug will start accumulating into the body, and when the more drug it is accumulated into the body, the concentration of the drug goes beyond the maximum effective concentration. And when it goes beyond therapeutic range, or that is maximum effective concentration, that drug will show the sign and symptom of toxicity. Okay, so there is increase in possibility of toxicity or the ADR because the drug are less efficiently eliminated from the body. So this could be the second reason why there is increase in incidence of the adverse drug reaction. Likewise, hemostatic mechanism, it is also called as compensatory mechanism in the body. So suppose if one organ, if it is not working, then the role of that organ, it is generally taken by another organ or another system which is present in the body. For example, if there is small change in a blood pressure, it can be controlled or it can be compensated to a body itself by increase in a heartbeat. So heartbeat will increase, cardiac output will increase, and it will normalize the blood pressure. But in case of elderly patient, this hemostatic mechanism it is disturbed, and as a result of that, there is less compensation of ADR. So I have just given one example, that is there is less compensation of the postural hypotension. So the hypotension which is happened due to change in a posture, maybe while standing the blood pressure is suddenly drop. Maybe while sitting there is no drop in a blood pressure, but when patients stand, their blood pressure get drop. So generally when we stand and our blood pressure is drop in case of adult patient, it can be easily compensated and managed by our own body system. But in elderly patient that doesn't happen. There is less compensation for the ADR. For example, postural hypotension, likewise many adverse drug reaction, there are less compensated and adjusted by the body. So that is the reason even though there are only small ADR are there, but the elderly patient, they are not able to tolerate it because the hemostatic mechanism, the balancing mechanism or compensatory mechanism of the body, it is disturbed. So this is the third reason. So this was the first reason. Was the second reason, that is elimination, it is affected. Third reason was the hemostatic mechanism, it is disturbed. Let's see the next reason for this. So it is also observed that the CNS become more sensitive to the action of sedative and hypnotics. So in case of elderly patients, their CNS it is more sensitive. So when you give the normal dose of the sedative in hypnotic drug, that may produces the more response. For example, if you give the sedative drug, it may produces the hypnotic effect. If you are giving hypnotic drug to induce the sleep, maybe elderly patient they suffer from the sedation throughout next day morning, right? That is not expected because you are giving hypnotic drug to produce good sleep only at a night and to improve performance during the daytime. But when it is given to the elderly patient, since their CNS it is more sensitive, it is also observed that the elderly patient they suffer from daytime confusion due to the dose of sedative and hypnotic drug. So what is the reason? So this is the fourth reason, because their CNS become more sensitive. In addition to that, it is also observed that there is change in immune response in the elderly patient. So this is the fifth reason. So, and if the immune response is changed, then body will react in inappropriate way to antigen antibody reaction, right? So since there is change in immune response, the elderly patient they are more liable to the allergic reaction because their immune system it is completely abnormal. So they are at high risk of the drug induced allergy. So we have seen good number of the reason for the increase in incident of the adverse reaction and the DI in case of elderly patient. The last reason it is impaired in the cognition, since the patient when they move from the adulthood to the elderly, their CNS function it is decreased, their intellectual ability is decreased, and when their intellectual ability is decreased, they doesn't remember to take the medicine. So sometimes they are not taking the medicine, and sometimes it is quite possible that they take double dose of the medicine, which may lead to the overdose, and that is called as inadvertent overdose, means overdose which is not intentional, which is due to unintentional overdose, and it may produces the adverse drug reaction. So we have seen total 6 reasons for there is increase in incident of adverse drug reaction and the drug interaction in case of elderly patient. So do remember that this is a very favorite question of the examiner. They generally come for 2 marks in the exam. Now let's see what are the changes occur in elderly patient, because as a pharmacist you must understand what are changes occur in the body of elderly patient, so that accordingly you can customize medicine or personalize medicine only for the elderly patient. So generally there are 2 types of changes which occur in elderly patient. First change it is called as pharmacokinetic change, and second change it is called as pharmacodynamic change. Okay, so both pharmacokinetics and pharmacodynamic changes are occur in the elderly patient, and since these changes are occur in elderly patient, it may alter the effect of some of the medicine which are related to the which is related to the pharmacokinetics and pharmacodynamics of the drug. So we'll see the step by step each type of pharmacodynamic change and pharmacokinetic change which occur in elderly patient. So let's start with the first change, that is a pharmacokinetic change. So we know that in case of pharmacokinetic there are 4 parameters. First one it is absorption, second one it is distribution, third one it is metabolism, and fourth one it is excretion or elimination. So we'll see one by one each parameter or each pharmacokinetic parameters how it is affected in elderly patient. So the absorption of the drug it is definitely going to affect in elderly patient, and it is depend upon the nature of the drug. For example, if it is polar means if it is the drug it is water soluble. For example, carbohydrates, iron, calcium and the thymines, then in such case it is observed that the water soluble drugs or the polar drug, their absorption it is reduced in case of elderly patient. So as a pharmacist, you know that the patient having the advanced age, and if the polar drugs are prescribed having the nature of the carbohydrate, or if they are iron, calcium preparation or the vitamin like the thymine, then you need to slightly increase the dose of these preparation in order to produce the desired peak plasma concentration or desired minimum effective concentration in the body and to increase therapeutic outcome. Okay, so the carbohydrate, iron, calcium and thymine, their absorption it is reduced because these are water soluble drug. Okay, Let's see next. I'm sorry, there was some message through the OBS, so I have just unclicked that. Yes. So the next parameter it is in case of the lipid soluble drug. So there could be two possibility. One, it is water soluble drug, polar drug, lipid soluble drug. Those are called as non-polar drug. So in case of lipid soluble drug, their absorption it is not impaired by the age. So their absorption it is not impaired by the age, so there is no worry about absorption of the drug in case of if the drug having the lipid solubility, if they are lipid soluble drug, so there is no need to adjust the dose of lipid soluble drug as far as their absorption it is concerned. Okay, in addition to that, it is observed that the intestinal blood flow it is reduced by the 50%, and the blood flow it's play a very important role for absorption of the drug, especially from the intestine into a blood circulation. Okay, and drug when you take through the oral route, obviously it is disintegrated, it undergo the process of dissolution, and it is absorbed into blood circulation. So that's depend upon amount of blood flow towards the intestine. Now if there is decrease in a blood flow by 50%, then proportionally there is also reduced in the absorption of the drug. So if there is 50% decrease in the blood flow to the intestine, obviously the 50% there is also the reduction in the absorption of the drug. If there is 70% reduction in the intestinal blood flow, there will be 70% reduction in the absorption of the drug, and accordingly the drug will attain less plasma concentration in the blood. And if there is less plasma concentration, there will be the less therapeutic outcome. So you need dose adjustment in case of those drugs which are the polar in nature, and if the blood flow to the intestine is reduced, then in case of all those drugs which are given through the oral route, you need to increase their dose so that appropriate level can be attained in the blood circulation to improve therapeutic outcome. So this is the first parameter about the absorption. So let's see about the second parameter, that is the distribution, how distribution of drug is affected, because distribution it's play a vital role to distribute the drug at the site of action and produce pharmacological effect. Suppose if it is distributed at different part of the body and there is less distribution at the site where the action it is expected, then obviously it is going to produce the less action or less therapeutic outcome. Okay, so let's see first what are the changes occur in the body of the elderly patient, and then try to understand how distribution of the drug it is affected. So first change which is occur in the body of elderly patient is there is a loss of lean body mass with the aging. What is the lean body mass? The lean body mass means there is decrease in a level of the body muscles. So the body muscles are decreased in the elderly patient. So the muscles are decreased, whereas there is increase in amount of fat in the body. So muscles are decreased, but there is increase in amount of the fat. Since amount of fat is increased, there is increase in the ratio of the fat to muscle and fat to body water. What this indicate? So amount of fat it is increased, since and muscles are reduced. Accordingly, the body water it is also reduced. So there is increase in the ratio of fat to muscle and fat to body water. Now overall, the fat content in the body it is increased as compared to the muscle content and the body water content. I hope you understood. Okay. Now, since these changes occur in the elderly patient, it is observed that there is enlarged in volume of distribution of fat soluble drug. Why fat soluble drug? Their distribution it is increased because the level of fat in the body it is increased as compared to muscle and the body water. So as a result of this, there is increase in volume of distribution of the diazepam and the lidocaine. Now the lidocaine it is generally local anesthetics, whereas diazepam their site of action it is central nervous system. Now imagine if diazepam, that is a lipid soluble drug, if it is distributed peripherally into the body, like in the body fat, in the belly fat, or different part of the body in the different fat, if it is accumulated, it won't reach to the central nervous system and it won't produces the expected pharmacological action on the central nervous system. So and why this happen? Because this happen due to increase in the fat content in the body, and due to that there is enlarging volume of distribution of different fat soluble drugs. So I have just quoted two examples like diazepam and lidocaine. In addition to this, distribution of the polar drug. What will happen to distribution of polar drug? Obviously, their water content it is reduced, so distribution of polar drug will reduce. Example, in case of the digoxin, their distribution it is going to reduce in the body. In addition to this, let's see what is the effect on the plasma protein, because plasma protein it's play a vital role in the distribution of the drug. It is observed that there is change in plasma protein, or there is fall in the level of the albumin, rise in the level of the gamma globulin. When level of albumin it is fall, then those drugs which having more plasma protein binding, their free concentration will increase. So increase in free concentration of those drugs may produce toxic effect. Likewise, rise in gamma globulin, so those drugs which bind to the gamma globulin, their free concentration will decrease and their pharmacological effect will decrease. So here there is increase in pharmacological action and produces the toxicity, whereas here there is decrease in pharmacological action and it produces the under effect due to change in the distribution of the drug. So before going ahead, let's quickly have the question and answer session. My first question is, why there is increase in incidence of adverse drug reaction and drug interaction in elderly patient? So let's see who give the first answer to my question. Yes, I'm waiting for your answer in the chat box. So there are different reasons for increase in incidence of adverse drug reaction. I'm expecting at least you give, every student give a different reason for this. We have seen total 5 reasons. Okay, so Zareen, very good. First to give the answer, mention about disturbance in hemostatic mechanism. Yes, very good. Tuba has mentioned about elderly patient need more number of drug at a time. It increases the risk of drug interaction. Very nice. Saqib mentioned about because of more number of drugs are needed at a time, so that may also lead to increase in incidence of ADR. Okay, so same answer quoted by the Nurun Nisa also. Then Aksa mentioned about elderly patient need more number of drugs, so same answer. Yes, Zareen has mentioned there is change in immune response which increases the possibility of the increase in the allergy. Okay, very nice. Let's see who give another one. Yes, Ashab, very good. You have given different answer. Impaired cognition. So due to impaired cognition, there could be possibility of not taking the medicine or taking the overdose of the drug. Okay, so very nice. Romana Sheikh has given another aspect, that is the drug elimination become less efficient, which lead to drug accumulation and toxicity related to drug accumulation. Very nice, Romana. Kavita has mentioned that CNS become more sensitive to the action of sedative and hypnotics, and that may also lead to adverse drug reaction. Nice to see. I think we have covered almost all the parameter for which there is increase in possibility of drug interaction and ADR in elderly patient. My next question is very simple. What happened to the absorption of carbohydrates, iron, calcium and thiamine in case of elderly patient? So answer is very simple. I'm expecting the answer simply like either you say or whether there is decrease in absorption or the increase in absorption of those drugs. So let's see who give the first answer. Okay, so Saqib, very nice. He has given the first answer. He has mentioned that. Aksa has also given, Nurun Nisa, Rafiq, Shagufta Shah. Nice to see that you all are active and giving the answer in the chat box. So there is a low absorption or there is reduced in absorption. It is seen in case of the polar drug. Obviously because their absorption is decreased because there is increase in a fat content. That is we have seen even in case of the distribution. Very nice. My last question is, what happened to the distribution of fat soluble drug in case of elderly patient? So when I talk about the fat soluble drug, I'm expecting the answer in terms of their volume of distribution. Yes. So let's see who give the first answer. Okay. You must be very quick in giving the answer, right? I can see some of you are giving answer of the first question when I have completed my second question. And some of you are giving the answer to the second question when I am asking you a third question. Yes. Yes, I'm expecting answer for the distribution. So nice to see Zareen again given the first answer. Today Zareen has given two answer first. Enlarge volume of distribution, that is VOD. Raunak has mentioned increase the volume of distribution. Obviously, if there is increase in volume of distribution, it is also going to increase the distribution of that drug in different parts. So especially the drug like diazepam and lidocaine, of those drugs which are lipid soluble, their volume of distribution it is going to increase, and due to increase in the volume of distribution, there may be sometime it may not reach actually to the site of action. So this could be the problem in case of the elderly patient, and which are related to the distribution of drug. Okay, so I'm happy to see that you are all are active, and you are learning out of this session. Okay, let's move on to the next part of today's session. So we have seen first two parameter of the pharmacokinetics, first one absorption and second one of distribution. Let's see about the hepatic metabolism. So the hepatic metabolism is the third parameter. So it is observed that in elderly patient there is decrease in hepatic clearance of many drugs. So since there is obviously all systems and organ their function it is decreased in case of elderly patient, and liver is also not an exceptional. So due to decrease in hepatic clearance of the drug, it reduces the metabolism of many drug like benzodiazepine, right? So now when metabolism of drug like benzodiazepine, if it is decreased, what is going to happen? When metabolism is decreased, obviously that drug is not going to excrete it into the body. It's remain as such in a body, and it may produces very slow accumulation. Now that drug it is keep on accumulating into the body, then it may produce the ADR, which is related to overdose or increase in pharmacological action of the drug, that is belong to the part 1 ADR. Okay, so the slow accumulation in the body produces the adverse effect, which having the onset from the days or the week after initiation of the therapy. Maybe ADR you may not see on the first dose of the drug, you may not see on the second dose, because the accumulation it is happening very slowly, which is directly proportional to the impairment of the liver function. Depend upon whether 10% liver impairment is there, 20% is there, 50% is there. Accordingly, there is the accumulation of the drug in the body, which may produce an adverse effect with the onset from the day to the week after initiation of the therapy. So when you are giving the drug which has to be metabolized by the liver, you must take care, or in case of the patient, or you can do the liver function test, and then you can go ahead with the medicine and take the decision on the dose to be given to the patient which who are elderly in nature. So we have seen the effect of the hepatic function, which is related to the metabolism. Next part of the pharmacokinetic, it is the renal excretion. Yes, there is also decrease in the renal function. So the decline renal function it is seen in elderly patient, and that is easily diagnosed by studying glomerular filtration rate. So if you see the GFR in elderly patient, it is very less. That is just 50 ml per minute. So almost 1/3 of glomerular filtration rate, and it may change from patient to patient as age is advanced. But it is not necessary that all elderly patients show same symptom. Some elderly patient, although their age is advanced, but their kidney working good, it's working as good as the adult patient, then in those cases no need to adjust the dose. But if you are giving the drug which are supposed to be excreted by the renal system, and if the age of patient is more, then in that case that you need to perform the glomerular function test. You must see the GFR rate and then accordingly take the decision. Okay, So when GFR it is less, it requires the dose adjustment. You need to give the less dose of the drug. Otherwise, there may be the accumulation of the drug in the body, which may produce the toxic effect. So the drug that require the dose adjustment in the elderly, so there is the list of the drug. You must remember as a pharmacist that if their GFR it is reduced, then accordingly you need to reduce the dose of those drugs. So you must consider this while dispensing medicine to the elderly patient. So if physician has not considered, then you should able to consider that, and you should correct this problem in the prescription. So let's see what are the drugs which need dose adjustment, like aminoglycoside, atenolol, which is given in case of the hypertension, diazepam, which is given in case of the convulsion or to induce the sleep, digoxin, which is the cardiotonic drug, NSAID given in case of the pain, oral hypoglycemic agent given in case of the diabetes, and lastly the warfarin, which is the anticoagulant drug. So all these drugs, they need dose adjustment because they are purely excreted into the urine. And since they are excreted into the urine, and since the GFR it is reduced, their excretion it is also reduced, and it may going to produce the toxic effect. So to avoid that, you can reduce the dose of this drug by considering their glomerular filtration rate. So better to do the GFR test, and then you can adjust the dose as per GFR rate. So proportionally you can adjust the dose. Okay. So we have seen the all four pharmacokinetic parameters, that is absorption, distribution, metabolism, and excretion. It is affected in case of the elderly patient. Let's move on to the pharmacodynamic changes occurring in case of elderly patient. So it is observed that in elderly patient there is increase in sensitivity to the central nervous system. So this we have already seen. So when you give benzodiazepine, maybe benzodiazepine given to elderly patient just for the hypnotic dose. So in hypnotic dose, what is expected? It is expected that hypnotic drug produce the sleep during the night. So for nighttime sleep, it is expected to produce the effect. But since it is given to the elderly patient where there is increase in sensitivity to the CNS, so benzodiazepine given to elderly patient at a hypnotic dose, it can produce the long daytime confusion even after single dose. So the single dose, it only produces the hypnotic effect, but during daytime also those elderly patients, they are confused because they are having some amount of drug effect, or we can say the residual drug effect, which is carried on throughout the day as well due to increase in sensitivity of central nervous system. So this is happened due to pharmacodynamic changes of the CNS. Second reason, it is increase in incidence of the postural hypotension. So this was also we have seen one of the reason. So when you give the drug like phenothiazine, which is belong to the category of antipsychotic drug like chlorpromazine or haloperidol, all these drugs are belong to the category of the phenothiazine. When you give this drug or the diuretics, it is given which increases the urinary output. It is observed that in elderly patient there is increase in incidence of postural hypotension when you are giving these drugs. So you must be careful when giving such drug because there is less compensatory mechanism. There is disturbance in hemostasis mechanism that contribute to the postural hypotension related to phenothiazine and diuretics. Next one, there is also reduce in a clotting factor synthesis. Now if clotting factor synthesis it is reduced, and if the patient is on treatment with the warfarin, then you need to reduce the dose of warfarin. Otherwise, the normal dose of the warfarin, it may produces the hemorrhage in elderly patient because their clotting factor synthesis it is reduced. So clotting factor synthesis is reduced. Obviously, blood clotting will also reduce. More thinning of blood is occurred due to the warfarin, and it may produce major. It may having the risk of major hemorrhage due to treatment with the warfarin. In addition to that, it is observed that there is increase in toxicity to the non-steroidal anti-inflammatory drug with in case of elderly patient. In addition, like other reason are increase in incident to the allergic reaction. Why? Because their immune system it is impaired, and those drugs which are allergic, which may not produce allergy to the normal patient or the adult patient, may increase the incidence of allergic reaction in case of elderly patient. Okay. So we have seen both pharmacokinetic and pharmacodynamic changes. Now let's quickly move on to the compliance in the elderly. It is observed that in elderly patient there is incomplete compliance. And as a pharmacist, you must consider this to increase therapeutic outcome. Let's try to understand why there is incomplete compliance in case of elderly patient. Compliance means the following the schedule of the prescription or following the prescription dosage which is given as per the physician. Okay. So why there is incomplete compliance? Let's see one by one. So the first reason for incomplete compliance, it is due to failure of the memory. So the drug, it is if it is taken to for a thrice a day, maybe sometime elderly patient they miss taking the medicine, and it may lead to non-compliance. So this is not intentional, this is unintentional compliance which is due to failure of the memory. Likewise, to not understand how to take the drug, sometimes due to effect on the intellectual ability, although you have explained to the elderly patient, but they have not comprehend it, they have not understand, and as a result of that they are not taking the medicine. Likewise, a previously prescribed drug which is stored in a cupboard, they are taking it from time to time. Maybe new prescription it is given, but still elderly patient, since already the drug it is there in a cupboard or maybe in the drug box, so they are removing the same drug along with the prescription drug and they are also taking those medicines. So it may lead to inadvertent overdose or the drug interaction. Okay, so this could be also possibility. So what solution you can provide to this? So as far as possible, the drug regimen should be the simple as possible, so that the patient or elderly patient can remember taking those medicine, and they can easily understand how to take the drug. So see that as a physician, he must prescribe the very simple regimen to the elderly patient. It should not be very complicated regimen. Okay. Likewise, there is improved method of the packaging also help. If you give the labeling process or good packaging material which can be easily read out by the patient, that also help you to improve the compliance in case of elderly patient. So let's see a few practical aspects in prescribing drug in case of elderly patient. So we'll see in detail how to remember this, but I have given you 4-point advice about practical aspect of prescribing drug to the elderly patient. So my first advice is take a full drug history including adverse drug reaction and use of OTC product by the elderly patient, because sometimes they are also taking OTC product and they may produces the drug interaction when prescription drug it is given to the elderly patient. So when they are coming to your medical shop, you must be cautious. You must take full history of the ADR they having in the past, or if they are already taking any over-the-counter medicine, right? So they take full drug history, first strategy. Second strategy, know the pharmacological action of the drug employed. So as a pharmacist, you must know what is pharmacological of drug that is dispensed, that you are going to dispense to the elderly patient, and try to understand correlate with their pharmacokinetics and pharmacodynamic changes, and try to predict the future adverse drug reactions. You need to foresee those ADR in those patients, and then accordingly you can decide the strategy. Third one, use lowest effective dose as far as possible, because we have seen their excretion it is decreased, their metabolism is also decreased. So as far as possible, you use lowest effective dose, or it may lead to cumulative toxicity in the elderly patient. So you use both lowest effective dose and fewest possible number of the drug, so that drug regimen can be simple in case of elderly patient. And last advice, it is to consider that the elderly patient, they are at the high risk of drug interaction. So the potential of drug interaction must be considered. So when you are giving the one prescription to elderly, you must ask him, is there any other medicine that you are already taking for other disease? If yes, try to correlate whether those drugs having drug interaction, right? So you must consider for the potential for the drug interaction, and also the possibility of comorbidity on the drug response. Maybe he's taking the prescription for the anti-diabetic drug and he might be suffer from hypertension also. So you must ask him, is there any problem you are already suffering from apart from this? Apart from diabetes, you having, is there any other problem? If yes, what medicine you are taking for that problem to solve that problem? If they say you about particular drug, but just enter into the software and see that those drug does not having harmful drug interaction, right? So there are 4-point approach. I call this approach as a TKUC. So TKUC, it is the take a full history, drug history of the patient. K for no pharmacological action of the drug employed. U for lowest effective dose and fewest possible number of drug. And C for consider potential for drug interaction and comorbidity on the drug response. Okay, so these are different practical aspects of prescribing drug to the elderly patient. You must consider during prescription by the physician, and as a pharmacist you must consider this practical approach while dispensing medicine to the elderly patient. So I have done almost done. Last part we'll see quickly. What other thing you can do. It is also important to pay attention on the formulation of the drug to be used, because many old people tolerate the liquid formulation or like elixir better than tablet and capsule, because they having the problem of the swallowing. So as far as possible, avoid taking the tablet which having the big size or capsule having the big size. Instead of that, if you give the elixir and the liquid medicine, it increases the patient compliance in elderly patient. Likewise, supervision of the drug administration, it is very necessary. You must actively supervise drug administration in elderly patient. Then container should be clearly labeled, and it should be easy to open, because some of the elderly patients, their hands are shivering and they are not able to open the container, and it may lead to non-compliance in the patient. So just sometimes the child-proof container which you made intentionally difficult to open, they are often grandparent-proof also. So the child-proof containers, sometimes they are often also grandparent-proof. So you must see that in case of elderly patient, if you are giving container, it should be such that they can easily open that container to improve the patient compliance. Okay, so I have done with my today's session. So just before I stop my session, let's quickly study one case study. So I suggest you to just go through this case study. I'm just reading out this case study and then try to understand what is happening and which drug is culprit behind this problem. Okay, so the previously mentally alert and well-oriented 90-year-old woman, so age is very high, 90-year-old woman, become acutely confused. Suddenly their memory it is affected. She suddenly become acutely confused 2 nights after hospital admission. So she was admitted for 2 nights in hospital, and after 2 nights she get acutely confused. Let's see what are the problems she was suffering from and what medicines were given. She was suffered from bronchial asthma, and on the basis of peak flow had responded well to inhaled salbutamol and oral prednisolone. So to reduce bronchial asthma, what medicine was given? The medicine given was salbutamol and oral prednisolone. Okay, so this was the medicine was given for the treatment of the bronchial asthma. In addition to this, she was on other medicine, like she was taking cimetidine for the dyspepsia. Maybe she was suffering from the acidity, so she was also on the treatment with the cimetidine. She was also on treatment with the digoxin for isolated episode of atrial fibrillation 2 years earlier. So this was her history, because now currently she is not on the treatment with the digoxin. So this was the history, and she has taken a nitrazepam, which is the hypnotic drug for nighttime sedation. Okay, so now my question is, out of these drugs, which drug it is responsible for acute confusion? Okay, so just quickly write about the drug which is responsible for acute confusion. I am waiting for your answer in the chat box. Okay, so we have seen about pharmacokinetics and pharmacodynamic parameters. Now based on the case study, you apply your knowledge and identify which drug it is responsible for acute confusion. So let's see who give the answer. I know that we are already late. Yes, come on. Yes, Rafiq given the answer. Rafiq, you are very right. Or it is a nitrazepam. Or Nurunnisa also mentioned the nitrazepam. Yes, so it is the nitrazepam. Why nitrazepam? Because nitrazepam, it is a sedative and hypnotic drug, and we have seen that there is pharmacodynamic changes in elderly patient where there is increase in the incidence of there is increase in the sensitivity of the CNS, and due to increase in the sensitivity of the CNS, it produces more daytime confusion. So the acute confusion that happens suddenly in the elderly patient, it was due to the nitrazepam. So I have a number of the case studies. I think at the end of when we finish the special population chapter, we'll discuss some of the case studies, so that as a pharmacist, your clinical aspects become more clear. Okay, so I will refer this book, the James M. Ritter, the Lion D. Lewis, and Timothy G.K. Mant and Albert Ferro, the Clinical Pharmacology and Therapeutics, the 5th edition textbooks, companion web publication. So I must thank the author of this textbook for providing wonderful content on special population. So thank you very much for watching my session. If you like my session, do remember to give me a thumbs up, and for more such learning, subscribe to my channel. Give me a 2 minute. I will be releasing the attendance and final quiz link in a chat box. So I can see, I think almost all of you can able to recognize the drug. The drug, it is the nitrazepam. Nice to see you are giving the answer in the chat box. I have also released the link for the quiz and feedback form for the today's session. Still, if you have any question, you are free to ask even after my live session also. You can put your question in a chat box. I am more than happy to answer your question.